with impeccable timing. We have our fourth speaker, Helen with the National Business Group on Health. And I just want to say here, it's been easy in these kinds of meetings. That I was expecting more of a town hall kind of meeting from August. I'm so excited by the deportment of the group here. But it's easy in a lot of these issues to demonize business and the insurance industry. And we've had the participation of the National Business Group on Health and the American Association of Health Insurance Plans. And I have to say, their contribution has been remarkable. There may have been any number of opportunities where they could have said this isn't quite the right mix that they want, and they didn't want to put resources into it. But largely because of Christie's leadership and consensus building, they've been a very active and very important part of the development of these recommendations and of the whole Alliance's strategies. So with that, I'll introduce one of the most experienced players in Washington and the healthcare scene, Helen Darling, President of the National Business Group on Health.
Did you have a chance to catch it?
Almost. That was perfect timing. I didn't plan it that way. It's like the tennis, I guess the great new tennis player from Georgia says, I don't mean to lose the first part and always win on the second. Well, first of all, I know I want to also sort of sing praises to Christy, whom I've known for a long time. We used to work in the Senate together. And she's a star in every way and a special friend. And anything that she's involved in, we know is going to be good and going to be successful. I'd like to focus particularly on the importance of research and evidence. And I was interested in the comments in introducing us, the National Business Group on Health. We, for a long time, felt that the solution, if you will, to the healthcare cost crisis and the safety crisis and the quality crisis and the health crisis, each of them is a little bit different, is really understanding what works and what doesn't. We spend, as you all know, $2.5 trillion, rising at about 6 to 8% per year. Probably will rise faster in the next few years. And yet, in some significant percentage of the time, some people say it's about 50% of the time, we actually pay for care and services that actually are not what you should be getting. Either it's not recommended care because we have new evidence that something works or doesn't, or there's a misdiagnosis, or there's a whole bunch of things that could cause our spending a lot of money right now on things that actually don't make a difference. And one of the things that I think is very exciting about the recommendation for coordinating research is that it will help us to find what works and what doesn't. And then it is a lot easier for those who are paying the bills, whether it's the private sector or government, to actually support those services and that care. And those activities that will promote health, including things like putting sidewalks so people can walk in cities and making safe places for people to be active. But we don't know nearly enough about what works. We have an institute on the cost and health effects of obesity that's now in its 7th year that we've been working on how to encourage employers and help employers to promote healthy lifestyle among not just their employees but their family members. And our biggest problem that we face is having more evidence about what works so that we can have, if you will, evidence-based recommendations. And there's some things we do know. And I think one of the wonderful things about these recommendations is they have identified those things we do know. But what we need to do is to coordinate and focus our research efforts around both the clinical settings. We have a lot in that regard. We need to understand more about what works with each individual patient, and we know it can vary, but we need evidence for all of that. We also need to understand more about the role of physicians and the role of other health professionals, which at least certainly in some of these areas that we're talking about, may be far more important than the physician, because they're going to be spending more time coaching and working with patients. And with all due respect to physicians, we do know that some things, especially when it takes a lot of time and patience to work through with individuals what works for them, then it's more likely to be nurses, nutritionists, allied health professionals, any number of people who will be, frankly, much better at providing those kinds of services. We also want the community setting. We need to understand more about what works in the community, and especially in the schools. I mean, we have children, if you start with daycare centers, we have children captive, if you will, for many hours a day. And for daycare centers and some other sort of preschool programs, we have them for 12 months mostly. So we have enormous opportunities to change, if you will. We talk about bending the curve in healthcare costs, and I think this alliance wants to bend the curve in terms of the obesity epidemic, and in particular to ensure that we have healthy people. Our workforce is unhealthy for the most part, and unfortunately children and young adults will be coming into the workforce, and if we don't change the curve, if we don't bend the trajectory, we will have a severely impaired workforce, and the nation's standard of living will continue going down, which it is right now. And then finally, we know that obesity itself is not a single problem, and it really results from any number of factors, some of which are highly individual to the patient, but the vast majority of which are really related to our environment. I know I'm preaching to the choir with this group, but we really have to understand more about what works, how we can change the community. One of the things that we recommend is that every dollar of federal funds requested across the country be accompanied by an obesity impact statement, so that when you're applying for funds, whatever they might be, you have to say, as the individual who's putting that proposal in to the federal government or the state government, as the case may be, for a mixture of federal and state funds, that in fact what that program or initiative will do to reduce obesity and overweight and unhealthy lifestyles in the country will be right there up front, so that when someone's making a decision about funding this program or that program, the ones that have a strong obesity impact statement will get priority. And we think every dime of federal money ought to be accompanied by that. Now, and that's not necessarily, you all haven't endorsed that, I want to say. That's the National Business Group on Health, so I'm not speaking for this group per se, but okay. But anyway, so there's a lot to be done, and I really, again, I want to repeat how grateful we are to have the opportunity to work with Christy and this organization to make a dent in the obesity curve along with the cost curve. And we think if we do that, we'll actually affect the cost curve too. So thank you.